All right, hi, I'm Evan. This is my father, Carl, and this is my comprehensive physical assessment. Okay, to start, can you just tell me your full name?
Carl Philip Ogden,
Okay, date of birth?
March 7, 1964.
Okay, how old does that make you?
58.
58 years old, okay. Looks like stated age matches up with apparent age. What is today's date?
December 1st, 2022.
Okay, and where are we right now?
San Diego, California.
Okay, looks like he's ANO times 4. Looks like he has appropriate stature, posture, and proportion of body limbs to trunk. We'll assess gait later. Body, breath, odors, none abnormally noted. Dress, hygiene, grooming, good. Speech seems clear. So to start, we're going to take a look at the skin. Okay, so if you just stretch out your legs. Okay, all right. Sorry if my hands are cold. All right. Just looking for any hyperpigmentation. Nothing noted. Just on general appearance. Skin seems warm, dry, intact. Temperature, no presence of fever. He seems normothermic. Skin turgor, just check this real quick. Immediate rebound. No edema noted. Skin integrity good. All right, so we're gonna start with the head. So I'm just gonna take a look at your head. I see normal hair distribution upon palpation, normal texture of hair. Cranium seems intact. No fontanelles present. No skin masses, lesions present. That's good. Normal hair distribution. So then we're going to move down to the face. Skin on the face, the integument looks clean. Looks normal for ethnicity. Normal hair distribution throughout. All right, moving on. We're going to looks very symmetrical too. So we're going to move on to some cranial nerve testing. All right, so can you do a lateral jaw movement? All right, looks good. All right. And then you're going to do jaw clenching. Okay, I'm going to feel it as you do it. Okay, yeah, sounds good. Can you go like this? Okay. All right, normal jaw clench movement. No presence of crepitus in the TMJ. Since we're here, I'm going to, let's see. All right, can you raise your eyebrows? Fast. Okay, can you puff out your cheeks? All right, smile big. Okay. All right, moving on to eyes. I'm gonna take a look at your eyes with a pen light first. Okay, so just look, focus on something in one of the records. Okay. All right. That's good. Okay, can you follow your eyes, or follow my finger with your eyes? Okay, good. So it looks like the eyes are perla. They contract to around 3 millimeters. Brisk contraction and accommodation, and as well as consensual eye movements. All right, so we're gonna do. You're gonna follow my finger, okay? All right, looks like his elims are intact. Just looking at the eyes, I see all eye structures look appropriate. No signs of papilledema, no signs of any skin lesions or new rashes or anything like that. Lacrimal structures seem they're producing adequate tears, no excessive tearing, so no need for palpation. Shoot. Let's see. Sclera looks mostly white with some injections in the conjunctiva. Irises look intact. No complaints of pain from the patient. So at this point, I would use the ophthalmoscope. I'm just going to use this as if it were. So then I would place a hand on the patient, and I would shine into his eye at 15 degrees to look for the red reflex, as well as the optic disc, and note any injections or any sort of presence of vasculature. I would do that on both sides with the left hand as well. Then I'd move on to the ears. His ears look nice and cute. It's got some moles, adequate hair distribution, no presence of any drainage, no presence of infection, no pain upon touch. At this point, I would use my scope to check out the ears. And I would imagine gray, intact tympanic membrane. When the left, the cone of light should be at 5 o'clock, and the left should be at 7 o'clock, right should be at 5 o'clock. No foreign bodies, no erythema, exudate, or edema. And then we're going to do the whisper test. So I'm going to whisper something like here, and you just repeat it in here. Okay?
I do have some hearing loss in my right ear.
Okay, so we'll see how this goes.
Okay, I heard that.
What did I say?
I couldn't make it out.
Okay, all right.
I heard.
You can hear, but you can't make it out. Okay.
Right. 3.
Okay, nice. So he can hear on the right, but as you mentioned, he has a little bit diminished hearing, so he can't make out the exact words. All right, so now we're going to move on to the nose. As mentioned previously, patient has a deviated septum on the right, which causes some congestion. Just looking at the nose, it looks symmetrical. No deformities, no masses, lesions. Appropriate skin tone for ethnicity. Looks patent. Can you breathe for me? So yeah, noted a little bit of congestion. At this point, I would take the scope to check the sinuses and so forth. All right, so now we're gonna check your mouth. Okay, can you open your mouth for me? All right, tongue looks like appropriate color. I don't see any edema. Can you go ah? Okay. So you can see the uvula. Okay, smile for me. Okay, teeth look intact. Gums look intact. I'm going to assess for tongue movement. Can you go this? Okay, all right. Looks symmetrical. All right, I'm going to rub this in your teeth. Tell me if there's any pain. I got ah. Okay, nothing? All right, I gotta push it, resist this. I'm gonna push it on your tongue. Resist it. Okay. Okay, he's got bilateral strength to tongue movement to the left and right. Uvula is symmetrical. So now we're gonna move down to the neck. At this point, I'm just gonna palpate all the lymph nodes starting at the head. So, these are sinuses. Any pain? No pain. No sinus pain. So then we're going to look at the preauricular. I don't feel anything here. Then we'll go post-auricular. No presence, no pain there.
No pain.
So then we move down to occipital, and then we go submandibular. I don't note anything here. And then this would be submental. No? Okay.
No pain.
All right, then I'm gonna go one side at a time for this. This would be your anterior. So I note a little nodule here. Nothing abnormal. Could just be from a previous sickness. Okay. And then the left. I note the same nodule on both sides right there. That would be the anterior lymph node bilaterally. All right, after checking all the lymph nodes, I'm going to check for your thyroid. So can you look that way? All right, so I'm going to just feel for it. All right, then once I feel for it, I'm going to ask you to swallow. You swallow. Okay, I can feel the thyroid. Doesn't seem enlarged. No pain upon palpation. All right. Would you mind taking your shirt off now? So I'm going to inspect the cranial spine. No issues there. Seems straight. You guys sit up for me? Oh no, you can just sit. There you go. Seems like he has normal lordosis of his cervical spine. Since I'm here, I'm just going to run down the back. Spine seems straight with appropriate a little bit of kyphosis into lordosis. All right, could you do some neck flexion for me, like this? All right, and then up, and then to the side. All right, and then can you touch your ear to your shoulder? Okay. Maybe limited mobility to the ear to shoulders. All right, now we're going to move on to upper extremities. So we're going to look at the shoulders. Seems like there's a normal symmetry. We got some adequate muscle mass. Skin tone seems appropriate, normal for ethnicity. Sensations, you feel the same both sides? Okay, all right, sensations intact. We got adequate cap refill. Check pulses. Pulses regular. Intact, 2+, both sides of the radials. Can you flex for me? Okay. You can let go. Pulse is regular, 1+ in the brachials. So nail color seems appropriate. Cap refill less than 2 seconds. I don't see any clubbing noted. Fingernails look appropriately trimmed. No erythema, exudates, or discoloration noted. I don't see any tremors or tics or fasciculations. Appropriate muscle mass. All right, so I'm gonna put my hand under joints as you flex your shoulders, okay? All right, just bring them all the way up. No issues there. Okay, I note some crepitus on the left shoulder. Okay, can you go out, abduct? Okay. All right, that's good. Can you do elbow flexion for me? Oh, sorry, let me feel it. Okay. Nice. Okay. And then can you just do wrists? I note crepitus in both wrists. All right, can you do ulnar deviations and radial deviations? All right, can you go like this for me? Rapid alternating movements intact. Sensation seems adequate bilaterally. All right, so now we're just going to test strength. So can you do everything I did for me except with low resistance? Okay, that's good. Now down. That's good. And out. Okay, up. All right, good. And then like this. Okay. 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 And then up, down. Yep. All right. Appropriate strength in all joints. All right, so now you're going to do the test where you touch your nose and then touch my finger, okay? And then you want to keep your eyes straight at me, okay? Oh, sorry. Okay. There you go. Nice. One more. All right, and the other side. Other hand. Good. 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 Okay. Looks like he has adequate proprioception with both hands. All right, now we're going to take a look at respiratory. So I'm going to take a look at the back here. All right. I note skin is normal for ethnicity. No masses, lesions noted. Adequate hair distribution. Adequate chest rise. Normal respiratory rhythm. I see chest expansion posteriorly as I rotate to the front. I see the AP diameter is 2 to 1 as is normal. Okay, and then now I'm going to percuss each lung and then take a listen to them. I see the difference in sound where the lungs end and it's just back at that point. Okay, since I'm here, I'm just going to percuss the front. Okay, adequate tympani reached on all 10 sites of all 5 lobes. All right. Upon percussion, no palpation or no evidence of masses or tenderness. All right. Now I'm gonna listen. All right. Every time I put it down, can you just take a deep breath for me? I'll start in the back. Good. Nice. All right, last one here. Note the right middle lobe. Nice. Can you put your arm up for me? All right. Lung sounds clear in all 5 lobes, posterior and anteriorly. No tenderness noted in the anterior. As upon assessment, anterior thorax is symmetrical with adequate chest rise, equal and effective chest rise. Percussion noted, auscultations noted. All right. Just looking, I don't see any evidence of any jugular venous distension. Okay, so now I'm gonna move on to your cardiovascular. Okay, so gonna listen to your lung sounds, your heart sounds. Okay, so I don't see any lifts or heaves upon inspection of the chest or the precordial area. I'm gonna start with the carotids. No bruise noted in the carotids. All right, S1, S2 heard in apical, pulmonic, Erb's point, tricuspid, mitral, with no additional S3 or S4. No bruise noted. All right, moving on to the abdomen. No notes of masses, lesions, striae, rashes, anything like that. Skin looks normal for ethnicity. Belly looks, abdomen looks flat. Let's see here. No, we have symmetrical appearance of the abdomen. No distension noted. No aortic pulsations noted. I'm gonna take a listen to see if for the aorta. I can feel the aortic pulsation upon palpation. No bruise noted in the aorta. Bowel sounds present in all four quadrants. Okay, so I'm just gonna just tell me if you feel any pain, okay? Okay. Nothing?
No.
Nope. No pain?
No.
Okay, take an inhale for me. Okay. All right. No pain at McBurney's point. No pain upon any percussion. No splenomegaly noted. Liver in the right upper quadrant approximated upon palpation. All right, so I'm just gonna do some deep palpations now, okay? Any pain?
No.
Okay, no pain noted upon deep palpation. For the sake of the video, I won't palpate femoral nodes or inguinal nodes, but it is noted my dad has had an inguinal hernia with a mesh repair. So I possibly could find inguinal in the navel area on both sides. I would assess those and check for a pulse, 1 to 4 plus. All right, moving on to the lower extremities. Would you mind taking your feet out here? Yeah. I'm just going to check pulses for dorsalis pedis. Seems there's a regular pulse both bilaterally 2+. Then I'm going to check posterior tibialis. Pulse noted both sides bilaterally 2+ as well. Just checking fingernails, no clubbing of the toenails, toenails. Adequate cap refill less than 2 seconds. How does that feel? Normal sensation. Adequate sensation bilaterally. Muscle mass looks adequate for age and gender. No evidence of tremors, tics, or fasciculations. Body looks normal upon movement and at rest. So now we're gonna do some hip movements. The last thing we're doing is some hip movements. If you could actually lie down for me. Make sure you're still in the video here. Okay. All right, so just gonna have you bring his hip up when I touch it, all the way up. All right, you can actually just bend your knee and bring it up. Okay. All right. Other side. Okay. No crepitus noted there. All right. Just move that. All right, could you bring this leg out? Okay, and the other way. All right, and then can you bring this leg over? All right, and then this one over there too. Okay, hip flexion, extension, abduction, adduction, all intact. No presence of any limitations there. Okay, before I have you stand up again, can you just bring your hip up again? Okay, looks like he's got adequate strength both sides, and we'll do the other way. Nice. All right, can you sit up again for me? Okay. So can you sit back? I'm gonna have you do knee extension and just extend your knees for me. Okay, and then flex them. All right, do it again. All right, noted some crepitus in the right knee. All right, can you do the same thing with your ankles? Or just like this, yeah. No crepitus noted bilaterally in the ankles. All right. Can you show me strength? Okay. All right. All right, all strength noted, 5 out of 5. Okay, can you do this? You got to bring your foot, your heel to your shin, rub it down. Okay, and then other way. Okay, appropriate proprioception. Adequate sensation. All right, got a couple more things. Last thing we're gonna do here are some deep tendon reflexes. Okay. Okay. Well, I didn't notice anything there. Try the other leg. Maybe I'm doing this wrong. Oh, is it this side? Well, it seems he doesn't have any DTRs in the knees.
Maybe it's.
Okay, and then I'm just gonna ask you to lift this up here, and then I do it back here. Be relaxed. Okay. Now do the same on this side. Not seeing any success with this. All right, no DTRs there. And then on the upper, I would do in the arms, gonna go like this. Relax it for me. And then the last one would be the tricep, right here. Okay, let me test the other arm. Does that hurt? The last one would be here. So that was deep tendon reflex for the wrist, for the brachioradialis, triceps, the patellar, and the posterior tibialis. All right, last thing I'm gonna have you do is stand up. I'm just gonna hold this. All right, so you're gonna put your hands up and then close your eyes. All right. Negative Romberg test. All right, and lastly, I'm gonna have you walk forward to me. All right, looks like he has steady gait, ambulating with steady gait. Yeah, I think that concludes our physical assessment. Thank you.